Hello everyone, how are you today? I am Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel. As you know, I make videos about health and healthcare topics, and all my videos are directly referenced from the internationally accepted US National Medical Library. So today I'm going to talk about another important topic, very commonly asked: psoriasis, right? Psoriasis. What is psoriasis? Why it happens? It's very common in many people and increasingly common these days because of the sun and bad environment exposures, etc., etc., etc. And a lot of people are having these problems in the skin, and it's very difficult to treat. So we are going to understand this problem today. So stay with me, okay?
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
So guys, what is psoriasis? Psoriasis is basically a skin condition where your skin becomes red and irritated. Because of irritation and redness, sometimes slowly your skin will get thickened. So there will be a thick, red and well described patch on the skin which will slowly become flaky, and then silver and white scales will form on that, right? So the basic reason is because of skin irritation and redness. Because of this irritation and redness, all these things happen. First, there will be thickening of the skin will become thick, and then well demarcated patches, flakes and silvery white scales will form, right? These patches are called plaques, right? And psoriasis is very common. Anyone can have it, anyone can develop it, but it most often begins in the ages of 15 to 35, 15 to 35 years, and it increases as people get older, right? And it is not contagious, it is not a transmittable disease. Like I said, it is because of skin irritation, not because of an infection, not because of a virus, not because of anything else, right? That means you are free to touch each other. You are not going to transmit it to them, or people are not going to get it from you, or you are not going to get it by touching another person who has psoriasis, all right? So don't worry about that. Psoriasis, but it does seem to be passed down through families, right? It is genetic. So your skin might have a genetic predisposition to get irritated easily, right? That is one thing. So what is the basic? See, normal skin cells basically grow deep inside the skin and rise to the surface, right? It is growing under the skin and slowly they rise to the surface, right? About after a month, right? Once a month, right? Every 28 days this cycle happens, right? Like I have explained it before. And when you have psoriasis, what happens is this process takes place in days rather than weeks. So it becomes faster in that small area. So think about it, how it will happen. Obviously that skin will become thickened, because losing of the skin is not getting lost from there, but it is being created very fast because of irritation. This results in the dead skin layer building up, right, on the skin surface. And because of this, there is formation of these scales, right? You're getting my point. So this is the basic problem, the baseline problem in psoriasis. And obviously it is because of skin irritation and redness, so there has to be some triggers of causing an attack of psoriasis, making it difficult to treat. Because until and unless this irritation is removed, right, this process will not stop, right? So some kind of things can actually irritate your skin. There might be triggers like dry air, dry skin, injury to the skin due to cuts, burns, insect bites, or other types of skin rashes, right? Stress, too little sunlight, too much sunlight. Yes, this is the dilemma here. It is actually one of the reasons. And then infections, some kind of infections like bacterial, viral infections which are happening somewhere else, like a throat infection, respiratory tract, upper respiratory tract infection. They can have this kind of reaction on the skin. So all these are triggers, right? Psoriasis can be worsened in a people who has a weak immune system, including those who have HIV/AIDS, right? So some people with psoriasis will also have arthritis, which is basically called psoriatic arthritis. That means this problem has also irritated their joints, and joints are also swollen. In addition, people with psoriasis have increased risk of many diseases like fatty liver, cardiovascular disease, and other such heart problems, and even stroke for that matter. So how will you know if you have psoriasis, right? Because psoriasis can appear slowly or even sometimes very suddenly also, and many times it can come and go away, come back and go away. Off and on it can appear like that, so you might even not even know that you have psoriasis, right? See, the main symptom of this condition is irritated red flaky plaques on the skin, and it is most commonly seen in the elbows, knees, middle of the body, but they can appear anywhere, including the scalp, in the head, palms, the soles of the feet, and even the genitalia. Yes, it can happen there. And what will happen? All these areas, wherever it is happening, the skin will be itchy, right? Dry. It will covered with scaly areas which are silvery or flaky, right? It might be red or pink in color. It might be raised and thick, right? Sometimes symptoms can also include, like I said, psoriatic arthritis. So joint pain, tendon pain or aching can also happen. Nail changes can also happen, right? Thickening of the nails, yellow, brown colored nails. Sometimes there are dents in the nails, or a lifting of the nail from the skin underneath. This can happen. And people with psoriasis can also have severe dandruff on their scalps too. Yes, that can happen. And if we talk about psoriasis, clinically they are described in 5 types of lesions. Basically, yes. First is erythrodermic, right? Erythrodermic means the skin is red and very intense, covering a large area, right? Skin is red and very intense, so that's why erythrodermic, red and erythra is same, right? And then second is gutted psoriasis means small pink red spots appearing in the skin, and this form is often linked to the throat infection, right? Especially in children. So gutted is small pink red spots in the skin. Third is inverse. Inverse means skin is red, irritated, but it occurs in the armpits, in the groin region, in between these overlapping skin is needed, right? Rather than the more commonly exposed knees and elbows. So inverse is this, overlapping skin areas, right? Then fourth is plaque. Plaque is basically, or plaque is basically a thick red patches of the skin which are covered by flaky silvery white scales, right? Almost same, I know, I understand, but this is the most common type of psoriasis, plaques, which we can see on the hands. And the fifth type is pustular. Pustular is when psoriasis get infected or pus gets filled inside the irritated skin, right? Then yellow pus filled blisters or pustules will be there, surrounded by red and irritated skin, right? So basically these are the 5 types of psoriasis. So your doctor can diagnose this condition straight away by looking at your skin. A dermatologist can just like do that. And if you want to confirm, then a skin biopsy, a small part of the skin can be taken out to rule out other possible conditions. And if you have joint involvement, then joints X-ray can also be done. Now let's come on to the treatment. The goal of the treatment of this condition is to control the symptoms and prevent infection, because it's an irritation. The irritation has to be stopped, the triggers has to be found and have to be stopped, right? So what options you have? You can apply skin lotions, ointments, creams, shampoos on your head, right? These are all included in the topical treatment which you apply on the external surface. Then there are some other options like pills and injections that affect the body's immune system, right? But this will not just affect your skin, this will affect the whole body. There is a systemic thing, body-wide treatment, right? But there is another treatment called phototherapy, right, in which ultraviolet light is used to treat psoriasis, right? So let's try and look at each of these things, right? First is the topical treatment. Most of the times this topical treatment is the first line treatment, and cortisone creams or ointment are used, steroid creams basically, other anti-inflammatory creams and ointments are used. That's why sandalwood oil is also good, because it's a natural occurring steroid. So sandalwood oil applied on the psoriatic lesions will give you relief. So will simple corticosteroid cream will give you relief, right? Then sometimes creams and ointments that contain coal tar or anthraline can also give relief, and creams which are there to remove the scaling, right? If you want to remove the scale, basically this is very, very thick skin. So thick skin has to be exfoliated. So salicylic acid. So salicylic acid cream or lactic acid creams are used, right? And then if you have dandruff shampoo has to be used over the counter or prescription, and moisturizers has to be used to prevent dry skin if dry skin is causing the itching, irritation. Then prescription medication can also contain vitamin D or vitamin A for the healthy skin growth, so that the skin becomes healthy. It's not dry. It's it has oxygen. It's basically nourishment, right? So these are all basic topical treatments, right? Then if things don't get control on this, then we go on to systemic treatment, medication, right? Only in very severe psoriasis this will be done. In this case, full body immune system suppression has to be done by giving you medications which are actually very serious medication, has to be given under a supervision of a doctor. These medications are similar to autoimmune disease medications, like we've discussed already in rheumatoid arthritis, in irritable bowel syndrome. So all these things, right? And these include methotrexate, cyclosporine. Then sometimes retinoids are given, such as acitretin, which is also given. And there are many newer drugs called biological agents, biologics, which are also available. These are used when other treatments do not work. Phototherapy is another line of treatment which for some people they can go for this, which is safe and it can be very effective. Right, this treatment is in which your skin is carefully exposed to ultraviolet light. It may be given alone, or it may be given after you take a small medication which makes your skin more sensitive to light. Right, it can be applied or taken. Right, phototherapy for psoriasis can actually be given as ultraviolet UVA or UVB light separately. Right. So if all these treatments don't work, and if at all there is an infection, pus formation in your psoriatic lesions, then your doctor can prescribe you antibiotics also, or else no, right? So lastly, let me give you some home remedies, right? How you can actually take care, live with this condition, prevent it to occur again, or just suppress it, right? First and foremost, take a daily bath or shower, and do not scrub. Do not scrub your skin too hard, because this can actually irritate and trigger an attack. Oatmeal can be used. Oatmeal baths basically can be used. It is very soothing and may help loosen these scales. Right? You can use over the counter oatmeal bath products also, which are available. Or you can just mix 1 cup of oatmeal, that is 240 ml of oatmeal, into a tub of warm water, and then bath with it. Keeping your skin clean and moist and avoiding the specific trigger which is irritating your skin according to you will help reduce the number of flares to a great extent, right? Sunlight can be of very help. Sunlight may help your symptoms to go away, and be careful not to get sunburned, but that's the precaution. You need to do some or the other relaxation or anti-stress techniques, right? The link between stress and flares is important, although it's not very well understood, but the link is very deep. So whenever you are stressed, the flares will increase, right? Remember this. So a healthy lifestyle, positive attitude is very important, right? And you can talk to a dermatologist if you are having severe problems. And if you're not getting treatment for this condition, and if treatment is not working, then complications can happen. And prognosis basically is that it is a lifelong condition. That means your skin will always have the tendency to flare up another scale. So you have to be cautious. You have to change your lifestyle. That is the only way. You have to take a lot of good vitamins, healthy, fruits, vegetables, a lot of water. You have to take a lot of antioxidants, right? Through these fruits, right? A lot of different antioxidants, not just one thing, right? That's the most important message here. It's a lifelong condition, has to be managed. Triggers have to be managed. You have to control all your these signs and symptoms, triggers, and get treatment whenever it's needed, right? And remember, it might come again, so don't worry about it. But with proper treatment, it will not affect your overall health. And be aware that there is a strong link between psoriasis and other health diseases like heart disease. So get tested regularly. Get tested regularly, get a health checkup once a year for all these diseases, heart disease and other diseases, so that you know if these diseases are getting, any formation in your body, are getting formed in your body, right? So talk to your doctor, talk to your dermatologist. If we talk about prevention, there is no known way to prevent psoriasis. Only thing is keeping the skin clean, moist, and avoiding triggers is the best way. Daily, you need to have a good skincare routine. No too much irritation. Don't use a lot of chemicals on your skin. Don't use a lot of scrubbing, right? Don't irritate your skin. Don't go out in extreme weathers, right? Eat a well-balanced, healthy diet. That's all you can do, right? This problem is a lifelong problem. It's also called plaque psoriasis, psoriasis vulgaris, guttate psoriasis, pustular psoriasis, and plain simple psoriasis. So this is all about psoriasis. Hope you got some helpful information through this video. If you did, then don't forget to subscribe and hit the bell icon and share this video with all your friends, family, and colleagues, because knowledge is always worth sharing. I'm Dr. Paramjeet. I'm a consultant physician and cardiologist in YASHODA Super Speciality Hospital, Nehru, Nagar, Delhi NCR, and you're watching Dr. Education. I'll see you next time. Stay connected, stay healthy.